My name's Elyse Dickerson, and I'm the CEO and co-founder of eosera. So we created these products that it sounds like you are using with a lot of your patients and having good success with.
Yeah. Well, very much nice to meet you, Elise. My name is
Yeah.
Nhat Pham. I'm a pediatrician, board certified, board trained itself, and also actually I'm a pediatric critical care doctor also that I do on top
Okay.
of that. But yeah, we're based out of Folsom, California. We're Rainbow Kids Urgent Care,
Okay.
and we're coming up on our 1 year anniversary of being open. Essentially, we're a specialty urgent care clinic in a strip mall itself, so people get access to specialty doctors, which include another one of my partners, who I'm one of the co-founders, who's also a pediatric critical care doctor,
Okay.
another partner who's a pediatric cardiologist, and another
Yeah.
partner who's actually a pediatric hospital medicine doctor. So a lot of expertise that they can find in a strip mall. But I came across your product, which I was actually very, very excited because prior to your product, we had something called Auralgan
Yes,
itself,
right.
which is essentially pharmaceutical driven
Yep.
product that we could give kids in the ER when they come by with significant ear pain itself. And then that came off the market, and we really had
Right.
nothing to effectively treat children's symptoms and their pain. Now, we could treat the infection, like a middle ear infection, with antibiotics, but we know it
Right.
takes days for the pain to actually resolve. And I got to tell you, the ear pain stories are consistent itself. Parents will come in the next morning and say, night was horrible. My kid was tossing and turning, complaining of ear pain. I didn't know what to do. They had a horrible sleep. I had horrible sleep. So I brought him in to look for an ear infection. And of course, we find an ear
Yeah.
infection. That's typical classic. But our option for pain management was very sparse. And I'd have to tell them it may take 2 to 3 days before you started noticing significant pain improvement. Try some Tylenol and Motrin, but really the nights were still rough for them. Then I was searching around and I said, there has to be something out there. And it was really interesting because I was able to find a few articles on actually lidocaine
Hmm.
topical itself that had showed really good promise of otitis media itself. And then I started using also in otitis externa when the
Yeah.
canal has pain also. And then I found your guys' product and I was like, oh my gosh, this is available. And it's over the counter. So it was life changing once I got involved with that and got the products. And I tried it on the patients. And I have actually changed my clinical practice now for children who come into our urgent care. And for instance, say we need to clean out the ears because there's wax occluding, so I can't make a diagnosis. I actually load both ear canals with some lidocaine first, numb it up, and then I go through the process of cleaning it out. And significantly, the amount of pain or discomfort the children feel while we're trying to clean out those ears, which usually is a hassle, has gone down dramatically. And then now I have a sample product that I actually can give them because we can't give them our lidocaine that we have in the urgent care. But I
Right.
actually have a sample I can give them and say, hey, this is actually available in the store. Go put a few drops in the ear, let the kid go to bed, and let the antibiotics do their job. And you can get pain relief. And parents are just blown away. Mainly because children, right? Children don't have
Totally.
a very good understanding of difference of pain versus discomfort and
That's right.
irritation. They just know something doesn't feel good and stop it. So thank you for creating it and putting it out on the market and I would tell you it's very surprising how much people don't know about it.
Right.
When I bring it up and they're like, oh my goodness, what is this? And it's really nice for me not only to tell them about the product that's available, but actually provide them a sample and say, this is actually what it looks like.